Pediatric dysphagia, page 92 to 93. Cranial nerve 5, trigeminal, which is the mandibular branch. The innervation is muscles of mastication, the masseter, soft palate, mylohyoid, and anterior belly of digastric. Motor is mastication in the oral stage. It helps in upward and anterior movement of the larynx, the tongue moving backwards towards the soft palate, movement of the tensor villi palatini, palate elevation, posterior wall constriction, and lowering of the palate to the pharynx. For sensory, it is the sensation to the structures of the face, mucous membrane of the upper mouth, the palate, the tongue, and sensation of the shape and texture in the mouth, and sensation to the palate and pharynx. Assessment of cranial nerve number 5 is to observe the face at rest and look for a unilateral or bilateral drooping or clenching. You should ask the child to open and close their mouth as fast as they can, and look for irregular movements. Another assessment is to observe contours of the temporalis and masseter muscles at rest. You should have the child stick their jaw out and move it side to side. With unilateral paralysis, the jaw will deviate to the paralyzed side. Cranial nerve number 7, the facial nerve. This nerve innervates muscles of facial expression, such as orbicularis oculi and oris, zygomatic, buccinator or platysma, and stylohyoid. Motor assists with elevation of the larynx. Lip and face muscles allow food to be held in the mouth, the movement of the palate, and elevation of the hyoid and tongue. For sensory, it's taste to the anterior 2/3 of the tongue, sensation to the floor of the mouth and the hard palate, as well as the soft palate. An assessment of the cranial nerve number 7, facial nerve, is to observe the corners of the mouth, as asymmetric drooping may indicate unilateral damage. You should observe the face at rest and during facial expressions. Look for masked or limited facial expressions and symmetry of movement. Have the child smile or close their eyes as tightly as they can. Note the symmetry of reaction of the corners of the mouth. Cranial nerve number 9, glossopharyngeal. For innervation, it is the stylopharyngeal muscle, the pharynx, the parotoid salivary gland. For motor, it is the elevation of the larynx and pharynx through the stylopharyngeus muscle, the palatal movement, pharyngeal and laryngeal movement, and epiglottic excursion. For sensory, it is taste and general sensation to the posterior 1/3 of the tongue, sensation to tonsils, upper pharynx, and soft palate. The glossopharyngeal portion mediated the sensory portion of the pharyngeal gag, taste to the tongue, and sensation to the palate and tongue. Assessments of cranial nerve number 9 is to observe the velum at rest, and then ask the child to forcefully say ah, ah, ah. Note unilateral or bilateral drooping. The uvula will point toward the non-damaged side. Test the child for strength of the gag reflex and look for hypo and hypersensitivity. Unilateral loss of the gag reflex. Cranial nerve number 10, the vagus nerve, innervates muscles of the soft palate, pharynx, intrinsic muscles of the larynx, and various muscles of the esophagus. For motor, it is the elevation and depression of the soft palate, elevation and closure of the larynx, movement of the larynx and esophagus, epiglottic excursion, the opening of the cricopharyngeal segment, and lowering of the larynx after the swallow. For sensory, it is the sensation to the pharynx, larynx, trachea, lungs, and epiglottis. It is the movement of the palate, laryngeal elevation, and sensation to the larynx and pharynx, as well as the epiglottis. Assessment of this nerve is to listen for the voice quality. Is it wet, breathy, hoarse? Test for strength of glottic closure and have the client cough hard. You should observe the velum and ask the client to swallow. Cranial nerve number 12, hypoglossal. It innervates intrinsic muscles of the tongue and some of the extrinsic muscles of the tongue. Superior longitudinal, inferior longitudinal, transverse, verticalis, genioglossus, hyoglossus, and styloglossus. Motor controls tongue movement, movements of the tongue backwards to the soft palate, and elevation of the hyoid bone and tongue. Sensory, there is none. Assessments of cranial nerve, number 12, is to observe the tongue at rest. Note tremors and atrophy. Have the client move their tongue from side to side and encourage the child not to use their jaw to move their tongue. Lastly, have the client stick out their tongue. Observe independent tongue movements without jaw assistance. You should note symmetry of protrusion. The tongue will deviate toward the side of the lesion. Thank you.